All right, good morning, everybody. We're going to go ahead and start the program. Welcome to our 2015 Solutions Summit. My name is Dan Mead-Smith. I'm the president of the Washington Policy Center. It's great to be with you. We were over in the Tri-Cities yesterday. We held the same event pretty much in Kennewick. So we'll have about 600 people at these two events over 2 days, had many of the same speakers, so you're in for a great program. Very well received, great presentations, so we're excited to present this to you here in Bellevue. I want to start off by thanking our sponsors. They're the ones that make events like this possible, especially a two-day event in two different parts of our state. They're listed in your program. But I want to thank our statewide sponsors, in particular, Brown Bear Car Wash, Chevron, Case Smith, Physicians Insurance, Primera Blue Cross, Silver Cloud Inns and Hotels, and Washington Trust Bank. And our local sponsors here in Bellevue, Associated Builders and Contractors, ABC, Columbia Bank, Keep Washington Competitive, Lilly, Synergy Construction, and Zymogenetics. So please join me in thanking all of our sponsors. We also had a great partnership with the Puget Sound Business Journal. They're our media sponsor for the event. Their publisher will be up here in a few minutes to welcome folks as well. And I want to thank all the co-presenting organizations, all the chambers, business groups that are listed on the back of the program. They help promote the event. Especially want to thank Women of Washington, who are holding their event with us at lunch today. So thank you for being with us. And I want to thank all the elected officials. We had a great turnout of elected officials in Tri-Cities and a lot of folks here in Bellevue. We're going to recognize them at lunch. But I do want to point out our statewide elected official, our Secretary of State, Kim Wyman, who's with us here at breakfast. So thank you for being with us, Kim. As many of you know who are part of the Policy Center and go to our events, we have a very dynamic young professionals program. We have a great outreach with young professionals across the state, both folks post-college and in college. We started our first club at the University of Washington just last year, and we have over 35 college students with us for today's program. So welcome all of you from Seattle Pacific, Seattle University, and University of Washington. And you'll hear from our Young Professionals Chairman, Nathan Rimmer, at lunch. Just want to go through some of the highlights of Washington Policy Center before we start the program. We had a great 2014. We're excited to kick off the new year with these two events, but it's good to look back on what we accomplished, and what we accomplished thanks to your support. We raised a record $2.3 million last year. We don't have a big endowment, or any endowment, so we have to raise our budget every year, and that's how we are effective and have an impact. So we appreciate all you've done for us over the last several years, including last year. As I mentioned, we launched our first college club at the University of Washington. We held debates for the very first time at the University of Washington in Gonzaga, and we have plans to do that again in 2015 and going to add Washington State University to our debate program. We celebrated the 5-year anniversary of our Eastern Washington office. There's copies of our quarterly magazine on your tables. That issue highlights our 5 years of work in Eastern Washington, which has exceeded our expectations, both in terms of bringing in new members, expanding our media coverage, but more importantly, expanding our policy impact. Several policy victories are because of having somebody in Eastern Washington. Our research and analysis helped save taxpayers $1.5 billion with the King County Metro Transit issue last year. Bob Pishu played a huge role in that issue last year, where not only did we help defeat the tax measure that saved the $1.5 billion, but more importantly, we saved bus service. So we said that was a false choice. You do not need to cut routes and raise taxes. So we actually were able to not raise taxes and save almost all of the routes. And eventually the entire King County Council was endorsing our recommendations at Washington Policy Center. Our work is in the media 5 times every day on average. That's a big way we get out our work around the state. And we also, even though we're a state think tank and focus mainly on Washington issues, we had a great year with national media attention. Todd Myers, our environmental director, is a national columnist for the Wall Street Journal. He contributed about 12 columns last year for the Journal. We also were on CBS This Morning for the first time, CNN, USA Today, Fox News. It was great to see our work getting national coverage last year. And one of our ideas, which is very much of a bipartisan issue and should not be very controversial, is seeing the light of day, and that's remote testimony. So we've advocated for the last couple of years through Jason Mercy at our Center for Government Reform of allowing citizens from around the state to testify in front of committees, but doing it remotely, whether you're in Vancouver or Bellingham or Spokane. There's no reason why you have to spend your entire day crossing the paths to testify before a committee, and you may only get 1 minute, or you may even not get called to testify. So we've said we should be able to go to a local community college in different communities and testify before committees to really open up state government to all citizens around the state, not just folks in Olympia. So the state Senate is now doing that. Jason was the first person to testify before a legislative committee in November. So it was a great experience for Washington Policy Center and a great thing for citizens of our state. So we're hoping that more Senate committees will do this during the 2015 session, but that was a nice policy victory going into the 2015 session. If you're new to the Policy Center, and I know some of you, this is your first event, I encourage you to fill out this white card on your tables. You can join the Policy Center for free for 6 months. And the next 6 months, obviously, are the legislative session. It's a great time to follow the work of our organization and to keep apprised of what's happening in Olympia. One reason we held this event this week is to time it with the start of the session on Monday. This is probably one of the most important legislative sessions in our state's history, given the issues that we're going to confront. So the Washington Policy Center is a great way to stay apprised of what's happening in Olympia. You'll receive our weekly emails, our publications, invitations to events. So if you're not a member, please fill this card out and return it to the registration desk, and we'll make sure that you are a member of the Policy Center. A couple just logistical announcements for parking. If you're only here for breakfast or the morning, you can get your ticket validated for 3 hours, and the parking is free. If you're here for all day, it's only $6. So just make sure you get it validated at the registration desk before you leave. And we take your comments and feedback very seriously. So that's how we plan our events. So there's a survey on your table. Please fill it out throughout the day and return it to us. And again, we'll use that feedback to plan our future events. So we're going to kick off our program with healthcare. Avik Roy has been one of our speakers at our healthcare conference that we do every year. A fantastic speaker, a very timely issue, obviously, with the new Congress. So we're kicking off with healthcare, then we'll go to small business. We had the same panelists in Tri-Cities yesterday. It's a fantastic program on minimum wage. Very, very great panel. So those 2 sessions will be here for the whole group, and then we'll go to our concurrent sessions starting at 9:30. So I'm going to turn it over to Roger Stark. Roger is our director of our Center for Healthcare, and talk about impact. Last year, Roger was featured in Forbes. A couple of his columns were in Forbes last year. And again, even though we're a state think tank and Roger testifies in Olympia, we were asked 3 times in just the last 12 months to testify before Congress on the Affordable Care Act. So a real testament to Roger's work at our organization. Roger.
Well, I too would like to take this opportunity to thank you for attending this morning and for your support of the Washington Policy Center. We really appreciate that. As Dan mentioned, a lot of what we have done over the last several years has been involved with the Affordable Care Act, or Obamacare. And in 2011, shortly after the law was passed, we wrote an impact study dealing specifically with the impact of Obamacare on the citizens of Washington State. After several years, it needed an update, and we updated it last year. Again, it deals with several demographic groups in the state of Washington and how the national law specifically affects the people of our state. There are copies on the back table out by the food, and please feel free to pick up one on your way out. This next session, as Dan said, is going to be critically important. And from a healthcare standpoint, the things that we're going to monitor are the expansion of Medicaid in the state of Washington. We're also going to monitor how the legislature proposes to finance the state health insurance benefit exchange. That's going to be a multi-million-dollar endeavor. And then the other thing that you folks need to be aware of that is sort of off the radar screen right now is a project that's funded through Obamacare that's called the Innovation Health Plan for the state of Washington. Legislation was proposed last year. It was totally watered down. Part of it passed. But again, this is going to be legislation that's going to be proposed again this session. And what it does, folks, is specifically a top-down government takeover of the healthcare system in the state of Washington. So everything, financing, regulatory issues and so forth will be driven through Olympia, through the state of Washington, even in the private sector. So again, this is something we're going to monitor and follow very closely this session. It is now my pleasure to introduce our healthcare speaker this morning, Mr. Avik Roy. Avik is a senior fellow at the Manhattan Institute and the opinion editor at Forbes. In 2012, he served as a healthcare advisor to Mitt Romney and the Romney campaign. He is the principal author of The Apothecary, the influential Forbes blog on healthcare policy and entitlement reform. He is a frequent guest on Fox News, NBC, MSNBC, Bloomberg, and PBS. His work appears in multiple national publications. He is the author of How Medicaid Fails the Poor, and most recently, he's authored Transcending Obamacare, a patient-centered plan for near-universal coverage and permanent fiscal solvency. Please join me in welcoming Avik Roy.
Thanks, Roger. Nice to be with you all again. I spoke at this conference, I guess it was a year and a half ago now, and I really always enjoy my trips to Washington. Last year when I was here a few times, I saw those green and dark blue 12 signs all around town. I didn't know what they were. I found out pretty quick. So I even wore Seahawks colors for you today. It's not really a fluorescent green tie, but it's the best I could do. But of course, we're not here to talk football. I've been working on for the last couple of years an approach to free market healthcare that really takes into account the way the healthcare system is today. We all talk about wanting to have a more market-oriented system, a less intrusive healthcare system, a system that works, a system that is solvent. And that's actually a really hard thing to accomplish. It's a very simple idea, but you have to think through and understand so much of what the government is already doing in healthcare, not just from Obamacare, but from a lot of other government programs. And so that's what we're going to talk about today, to walk you through how the government is involved in the healthcare system today and how we can actually make that system not just more solvent, but more affordable and more attractive for everyone, the poor, the rich, the northerners, the southerners, people all across this country. So the first thing to understand, the reason I got into this, so I'm relatively new to the think tank world. I've only been doing this for about 4.5 years. I was sitting in front of my computer screen one day during the financial crisis, and I saw this chart. This is from the Congressional Budget Office, and it's their long-term projection of federal spending over the next 75 years as a share of GDP, or of annual economic output. And what this chart is showing you, which is actually pretty amazing, is that literally every dollar in the growth of federal spending as a share of our economy is healthcare. The light blue at the bottom, that's everything else the federal government spends money on. That's the military, Social Security, food stamps, unemployment benefits, bridges to nowhere, National Institutes of Health. Whatever you think the government should or shouldn't be doing other than healthcare, it's all in that blue part of the chart. That's not growing as a share of the economy. That's actually kind of encouraging, right? But what's really growing is healthcare and, of course, interest on the debt. So we're not going to get to 2050 on this chart, right? Because there's going to be a financial crisis. China's going to pull the credit card. We're not going to be able to pay off those interest payments because when you get to this point, the amount of revenue we get from taxes is not enough to pay just the interest on the debt if we just go by current law. So if we want to change that, we either have to reform the system now, or if we keep it like this, wait for the crisis and then be like Greece, where you slash payments for these government programs for the people who depend on those programs the most. Who gets affected when you have severe fiscal austerity? It's the people who really depend on government programs, right? So unless you reform that red part of the chart now, you'll never be able to fix anything else. And that's how I got involved in this. I knew that unless we did something about the healthcare problem specifically, the fiscal problems that we have in this country will never solve. Now, does Obamacare make this problem worse? Yes, it does spend more money on healthcare. It spends about $2 trillion over the next 10 years, expanding or subsidizing coverage for people who don't have health insurance today. So that's more money than we spend now. But actually, if you change the y-axis on this chart and then layer in what the federal government is already spending on healthcare, it gives you a different perspective. A lot of Republicans like to talk about how Obamacare is the government takeover of the healthcare system. Maybe you've heard that line yourself. Maybe you thought that yourself. But if Obamacare is the government takeover of the healthcare system, then what's all that? Right? That's Medicare and Medicaid and a bunch of other things the federal government has been doing since 1965. So in 1965, after Goldwater went down in flames in the 1964 election, Democrats had these gigantic majorities in Congress. LBJ passed the Great Society legislation, including Medicare and Medicaid. That is what is driving the fiscal crisis in this country. So we could repeal and replace Obamacare like every Republican says we ought to do, and that's great, but you're not doing anything about the fundamental problem that's actually driving us over the fiscal cliff. So if we really want to fix the problem, yeah, you gotta do something about Obamacare, but you gotta do something about the entire trajectory of federal health care spending. So you gotta think about the whole pie, not just that one narrow slice of it that's Obamacare. Here's another way to think about this same set of data. So this chart I know is hard to read, especially for you in the back, and I can send this slide to anyone who wants to look at it. What this chart is showing you is per capita government spending on health care in the industrialized world. So the United States is that red bar, third from the top. So amazingly enough, even before Obamacare has been implemented, so Obamacare spending didn't go into effect really until this past year, 2014. So this is from 2012. What this is showing you is that before Obamacare went into effect, government spending on health care in the United States was the third highest in the whole world. Right? So if we had this free market capitalist health care system before Obamacare, how is it possible that government spending on health care before Obamacare was the third highest in the world? A lot higher, by the way, than Canada or France or Germany or Sweden. We were spending almost $4,200 a year per person, even though we have 50 million people or 40 million people who are uninsured in America today. So these people all have universal coverage. They actually spend a little bit less than we do. So the left will make that argument. They'll say, look, we should have single payer because it spends less. Well, yes, it spends less because they have price controls and rationing and a bunch of other things. There are other ways to achieve a better solution than the one we have. But the point of this is to say the U.S. healthcare system before Obamacare was not fine. It was a mess. It was expensive. It's driving us to bankruptcy. It's also making healthcare so much less affordable for average Americans. Because if you're an average American, you're paying taxes to subsidize all that, plus you're paying these crazy premiums just to be able to afford the health care that you have, where the deductibles are going up and the copays are going up and everything else. So this is a huge problem. And if the Republican message on health care is, well, we're going to repeal Obamacare, well, that's great. But there's a lot of other problems with the health care system that we have to fix. Here's another way to think about this. So why is it that health care in America is so much more expensive than pretty much every place else? A big part of the reason is that in 1965, and even before 1965, we decided we were going to subsidize health care for a lot of people without asking them to chip in any of the cost or be concerned about the cost at all. So what this graph is plotting out for you is take $100 in 1968. If you take $100 in 1968 and then plot that out 50 years or 40 years, by 2008, if it was just inflation, that $100 would be $700 today. If it were in the stock market, that $100, it'd be maybe like $1,700 today, because that's GDP growth. This red bar is Medicare, right? So what we thought we were spending $100 on in Medicare in 1968 is a gigantic sum today. In 1965, when they passed Medicare, they thought in 1990 Medicare would cost $10 billion a year in federal spending. Instead, it was $110 billion a year in federal spending. Today, we're spending $700 billion a year in Medicare federal spending, right? So this is a program that is completely out of control, and it's very simple to understand, actually. What we do in America that's unique is we have neither a single-payer socialized system or a true free market system. We actually have the worst of both worlds. So we subsidize health care for everybody, but we don't put any cost controls on how that money is spent. And it's not just, by the way, the poor or the slackers who get subsidies in our system. It's actually upper-income people who get the lion's share of the subsidies to consume health care in our country. Because, of course, if you're very wealthy and you're on Medicare, if you're Mitt Romney or Warren Buffett and you're over 65, you get Medicare, just like everyone else. I pay taxes so that Mitt Romney can get subsidized, government-subsidized health insurance. Not only that, but actually, everyone in this room who gets health insurance through their job is getting federally subsidized health insurance. You may not realize that. But think about it this way. When you get $100 in wages, you pay taxes on that, right? You pay federal taxes here. I know you don't pay state income taxes, but you also pay Social Security and Medicare taxes and all that. For the typical person, maybe that's 50% of that $100 is going to one government entity or another, right? But the value of your health insurance is excluded from taxation. You don't pay any income tax on that. You don't pay any payroll tax on that. And the value of that tax break is actually larger than the amount of money we spend on Medicaid. It's almost as large as what we spend on Medicare. And because most of us get insurance through our work and never really pay attention to how much it costs, we consume a lot more health insurance than everybody else. The way I talk about this is, think about a cash bar versus an open bar, right? You go to the cash bar and maybe you get the Bud Light, or maybe there's some, white wine, some fancy Washington Chardonnay that's relatively inexpensive. But if it's an open bar, especially if it's like an in-law's wedding or something, you're going to get that single malt scotch or the champagne or the microbrew from down the street or whatever it is, right? And that's how our healthcare system works, is that we all go to the doctor saying, give me the best possible care. That's what I deserve. That's what I've paid for. You have no idea of how much it costs. In fact, if you actually ask the doctor, how much does this test cost that you're asking me to do, he won't even be able to tell you, because he doesn't know, because he's never had anyone ask him before, right? That's how messed up our system is. It's not just third-party payment for healthcare, but it's third-party payment for insurance, because none of us shop for our insurance ourselves, almost none of us. And so it's really ninth-party payment for health care that we have in this country. Is it any surprise that the costs are out of control when we're so divorced from the cost and the value and the quality of what we spend? And so this is what happens. Hospitals charge 5 times as much in the United States for exactly the same service as European countries do, not because of price controls and regulation, but because nobody holds them accountable. There's no consumer saying, hey, why are you charging me $10,000 for the thing that other hospitals can charge me $3,000 for? You don't even know that there's a differential between the two hospitals that are across the street from each other or down the street from each other, because you never see the bill, or you see this bill, it's this jumble of numbers, but you're not paying for any of that, so you don't really read it. I barely read those bills, right? So this is what's happened, is hospitals charge more and more and more in the United States, knowing that because you're not paying for it directly, you're not going to pay attention. And no one is going to be a steward of your money more than you, right? So if somebody else is paying the bill, then that's where the waste comes in. What does Obamacare do to try to address all these problems? Pretty much nothing. So what Obamacare does is it expands coverage using one of the government programs, in part, called Medicaid, which many of you may be familiar with. Washington State has decided to expand its Medicaid program a la Obamacare's design. The problem is, a lot of doctors don't take Medicaid, because Medicaid pays doctors a lot less than private insurance companies pay. So what this chart on the right is showing you is the percentage of doctors who won't accept you as a patient depending on your type of insurance. So if you have private insurance, which is the dark blue, most doctors will take you. There's a really low rejection rate, so a lower number is good here. A smaller bar is good here. Depending on your specialty, these are different specialties, OBGYN over here, all physicians on the left. If you have private insurance, most doctors will take it. If you have Medicare, increasing number of doctors saying, you know what, no, I'm not going to take Medicare. Why? Because Medicare is paying doctors less and less to treat the same basic level of service. Medicaid is even worse. So the reason Obamacare used Medicaid to expand health care to the coverage to the poor is because it's cheaper, because it pays doctors a lot less. It had a better budget score. But the problem is, a lot of doctors don't take Medicaid. So you have this card that says you have Medicaid, but you don't actually get health care because a lot of doctors don't take your insurance. So that's why a lot of studies show that health outcomes for people on Medicaid are no better than those for people with no insurance at all. Obamacare also introduces a layer of federal regulation into the insurance market for people who shop for coverage on their own. That drives up the cost of health insurance. So, all these things that insurance plans now have to cover. Well, that sounds great until you realize that your premiums go up because of that, right? It's like if your car has to have a hybrid engine and a really fancy stereo system, if the Congress passed a law forcing every car to do that, then every car is going to be more expensive. Maybe you don't want a stereo system in your car. Maybe you want to plug in your iPhone or whatever, right? You're not going to be able to do that. So that's why these healthcare costs or healthcare premiums are going up under Obamacare, particularly, again, for people who shop for coverage on their own. Now, there are a couple of good things that are happening independent of Obamacare. One of those is that an increasing number of employers are trying to figure out ways to give you more control of your healthcare dollars. They realize that just giving you the health insurance hasn't worked because then you just go consume healthcare whenever you want, the open bar style. So they're now saying, we'll give you the $5,000 that we're paying for your health insurance plan and let you shop for like 10 different health insurance plans. And maybe you find one that's better for you and you can capture the savings if you choose a less expensive plan, and you can pay the extra amount if you want to have a more expensive plan. And so that's introducing a level of consumerism back into the insurance market. Whereas again, today, most people your company just hands you your insurance plan. More and more people are moving to this model where you can actually choose from a selection of plans, and the company is giving you a block of money to do that. More and more companies are actually using health savings accounts, which is an even better approach, right? Because with health savings accounts, you're paying for health care directly, not merely shopping for insurance directly, right? Think about this. Think about auto insurance, right? You buy auto insurance so that if your car crashes or your car gets stolen, you're not in the hole for $30,000 or whatever. The insurance company pays that off, right? But you don't have auto insurance to pay for your gasoline or your wiper fluid or your car wash. If you did, then of course you're going to get the premium super deluxe car wash every single time, right? The same thing with healthcare. So the more you can move to this model where you're using a health savings account to go to the doctor, the more you can actually have control over those costs and figure out how much people are charging. So that incredibly improves the efficiency and the quality of healthcare. Think about this. You hear health economists and wonks, all these people, think tank people, they always talk about, we're going to have a patient-centered healthcare system. When the government controls everything, you're never going to have a patient-centered healthcare system. You want to have a patient-centered healthcare system? Have the patient control the dollars. When the patient controls the dollars, you'll have a patient-centered healthcare system. Just like we have a consumer-centered everything else system because you're paying the dollars. And if the store doesn't appeal to you, they're not going to get your business. The same needs to happen in healthcare. So is there a better way than what Obamacare has imposed upon us? I would argue, of course, that there is. So the one thing that we have to first understand is that when Mitt Romney lost in 2012, that really did change the equation on what the options were for Republicans. You still hear a lot of Republicans talk about how they're going to repeal Obamacare. But the reality is, now that Obamacare is going into effect, tens of millions of Americans are going to be enrolled in Obamacare-sponsored health insurance, whether they want to be or not. So these numbers are from the Congressional Budget Office. This next set of numbers is what the Obama administration is estimating are the number of people who are going to be enrolled in either the Medicaid expansion, which is the dark blue, or these website-based exchange policies in the light blue. But that's a lot of people, right? So not all those people were previously uninsured. A lot of those people had insurance and their old plans were canceled. But this is a lot of people. So even if Republicans win the 2016 presidential election, keep the Senate, keep the House, they're still going to have to deal with the fact that 20 million people plus, maybe even 30 million people, are going to be on these Obamacare-sponsored plans. So if you repeal Obamacare, you're disrupting insurance for a lot of people. If you thought Obama's promise, if you like your plan, you can keep your plan, was terrible, imagine what's going to happen when Republicans repeal Obamacare and take 30 million people or 20 million people off their health insurance. It's not going to work. So that's just the reality. Whether you hate Obamacare or you love it, I mean that's just one of the things that's one, that you have to think through. You can also think about it from a standpoint of what the public actually supports. So we all know, if you follow the polls, that Obamacare is pretty unpopular. This is a pretty typical poll. Public, by a margin of about 11%, says that they disapprove of Obamacare versus approving it. But if you actually ask people whether they support repealing Obamacare or not, you get the opposite result. Actually, people oppose repeal by pretty much the same numbers by which they disapprove of Obamacare. So why is that? Well, part of it, of course, is some people are concerned about the drama and the disruption of repealing Obamacare. Part of it is that actually a lot of the people who don't like Obamacare are advocates of single-payer government-run health care who think Obamacare is too conservative. So if you look at this slide, this dark blue part of the pie chart are the people on the left who say Obamacare did not go far enough. A lot of those people are the people who disapprove of Obamacare. They see it as a giveaway, $1 trillion giveaway to the insurance companies. Right? That's what Howard Dean had this famous meltdown on MSNBC when they got rid of the public option in Obamacare, if you remember that debate, where he said we should just scratch this bill and start over because it's a giveaway to the insurance companies. So because Obamacare does not abolish the private sector, a lot of people on the left don't like it. But if you actually break this out by Republicans, Independents, and Democrats, the independents are what really striking. 2-to-1, by a margin of 2-to-1, independents say don't repeal it, maybe roll it back a little bit, change some things, but don't repeal it. Let's take the existing system and move forward. And there's a lot of different ways to slice those poll questions and those poll numbers. They all pretty much come out the same. If you want to appeal to a broad majority of the country and not just the Republican base, you've got to really think about talking about reform of the whole health care system, including Obamacare, and not simply repealing Obamacare and coming up with something else. Because what politician is going to be trusted to say, trust me, I'm taking away your health insurance, but I got a better idea? No politician is going to be trusted to do that. So you got to come up with a different way. The other thing that's really important to understand about this from the politics standpoint of it is that Republicans are not going to control 60 votes in the Senate. As you all know, you have to have 60 votes in the Senate if you want to pass something unilaterally. Democrats had that in 2010, briefly. Republicans will not have that in 2017. They have 54 Senate seats as of today, but they're actually defending a lot of seats in blue states in the 2016 election. So they'll be lucky if they still have 54 seats in 2017. So if you're not going to be able to have a filibuster-proof majority, any reform you want to make to the health care system, it has to appeal to at least a small number of Democrats, a half dozen or so, right? Maybe 8. But you don't have to appeal to every Democrat. You don't have to appeal to the hard left. But you have to appeal to the more moderate Democrats who are open to a bipartisan solution. Republicans will not have the opportunity to jam down people's throats a partisan solution as much as you might want to as a kind of a revenge thing. It's just not going to be mathematically possible. So going back to this chart, I'd mentioned that it's striking that Obamacare, that America spends so much on government health care, right? But look at these countries at the bottom of the list. There's 2 in particular I want to highlight, Switzerland and Singapore. So Switzerland and Singapore are actually the countries, not the United States, that have the most free market or market-oriented healthcare system in the world. I'm going to explain why that is. So here's the interesting thing about Switzerland. Switzerland actually and the Obamacare exchanges have some similarities. They offer subsidies to the low-income people on a sliding scale. So if you're really poor, your premium's fully subsidized. If you're moderately poor, you're moderately subsidized. If you're upper income, you don't get a subsidy under the Swiss system. But what's different about Switzerland is that there's no public option. There's no single-payer element. There's no government-run health care, government-run health insurance. It's all private insurance. Every single Swiss citizen shops for health insurance. 45% of Swiss citizens have health savings accounts because they choose plans voluntarily that are oriented towards health savings accounts. So they have a much more efficient, much more cost-efficient system than we do. Big surprise. Singapore is even more impressive. Now, their system isn't really easily translatable to what we do, but they have universal system of catastrophic insurance. So just like auto insurance, you get hit by a bus, you have a stroke, you have cancer, the insurance product covers you. But they take what we pay in Social Security and Medicare taxes, and they give that back to you in a health savings account that you then use to shop for your non-urgent, non-catastrophic health care needs. And they spend 1/7 of what we spend on health care. It's an incredibly powerful system that they've figured out how to do. Now, you could say Switzerland and Singapore are small countries, but economics are economics. And there are a lot of studies that show that even if you adjust for the fact they're small countries, these systems are powerfully more efficient than what we do here and what a lot of the European countries do. Here's another way to think about it. The Heritage Foundation every year lists the countries, ranks all the countries in the world by their economic freedom, their overall economic freedom. The U.S. in the most recent survey ranked 12th. The 11 countries that are above us, 10 of them have universal health coverage. Now, some of those systems we wouldn't want. We wouldn't want the Canadian system, for example. But look at Switzerland and Singapore. They're right up there at the top. The point I'm trying to make here is that universal coverage and single payer are not the same things. So I think a lot of us, both on the right and the left, have conflated those two terms. We say, well, universal coverage is going to be bad. It means the end of economic freedom in America because that'll be like single payer. Well, no, single payer is a specific type of universal coverage where the government runs the healthcare system. You can also have a system like Switzerland where you basically say, okay, if you're really poor, we'll write you a check, we'll give you a voucher to shop for a health insurance plan that'll suit your needs. But everyone else, shop for health insurance that you need. We don't need to subsidize it. You can afford it. And if you do that, you have a much more free and much more market-oriented and much more solvent system than the system we have today. So you can actually cover more people and have a freer and less expensive system than the one that the United States has. So what is it that we actually do in this country? We have a mix of different systems. So believe it or not, we actually have 90 million people in America, give or take with some asterisks, who are on single-payer health care. So this is kind of before Obamacare. So people ask, well, is Obamacare the route to single-payer health care in this country? Is the Trojan horse for single-payer health care? Well, actually, there are 90 million people who are already on single-payer. Medicare is effectively single-payer health care. Medicaid is effectively single-payer health care. Again, there are some private sector facades on some of these programs, but that's effectively what they are. That's how they were designed. Yeah, there's a bunch of people who are on employer-sponsored insurance. That's not really market-based insurance, as I mentioned, because you're not choosing that plan yourself. Someone is choosing it for you. There's a sliver of people in the yellow who are buying insurance for themselves on their own, and there's a bunch of people uninsured. What Obamacare does is it expands Medicaid, and it expands the number of people who shop for coverage on their own in these highly regulated, over-regulated exchanges. So Obamacare, it's no Trojan horse. It's right there in the law. It expands single-payer health care, expands Medicaid. But it also, with a silver lining, if you can call it that, the very thin silver lining of Obamacare, is it does expand the number of people who, for better or for worse, are shopping for their own health insurance, which consumerist advocates should support in general. Though, again, the Obamacare implementation leaves something to be desired. So what does that tell you? Actually, there's an opportunity here. So if you think about what Paul Ryan has campaigned on doing to reform Medicare, what he's basically said is take a premium support payment, give the senior those dollars that he's now getting from Medicare, give him those dollars and let him shop for a health insurance plan. We'll make sure, we'll put in some protections, some guarantees to make sure those health insurance plans cover a certain set of benefits, but generally we'll give the seniors that choice. That's what Paul Ryan has wanted to do with Medicare, and that's what he's getting pilloried for by the Democrats. Ironically, the Obamacare exchanges work in a very similar fashion. So a very simple idea for a kind of a jujitsu move with healthcare is to say, well, Democrats, you think that Obamacare's exchange is so great. Well, why don't we take a reformed version of those exchanges and offer them to people on Medicare and Medicaid? If you do that, you might actually get something very close to what Switzerland has, right? So you can actually make the U.S. system like Switzerland very simply by simply taking those Obamacare exchanges, reforming them, and then gradually expanding the people who are eligible for those exchanges to pretty much the whole country. And then all you do is take this pie chart and put everyone in the individual market, people who shop for coverage on their own. It turns out you can do an enormous amount of good with that approach. And it's harder for Democrats to attack because it takes a tool that they've introduced to the healthcare system and uses it for a broader set of reforms. So how would you actually do this in reality? So this is the very simplified version of this plan. If you want to read the whole thing, the 20,000-word version, you can download it from the Manhattan Institute website. But the first thing to do is to liberalize the exchanges. So the Obamacare exchanges do a lot of bad things. They overregulate the kinds of insurance that you can buy and don't give you that freedom to say, you know what, I want to go with a health savings account and a catastrophic insurance plan. They force you to buy insurance, even if you don't find any insurance in your particular part of the country that you really want to buy. So there are a lot of things that Obamacare does. It massively raises taxes by $1.3 trillion over the next 10 years. You can roll all that back, repeal pretty much all of that. You can repeal most of the regulations and all of the tax increases that affect the insurance market, except for the Cadillac tax, which is sort of an asterisk. But liberalize the exchanges, give people the real market. So what Republicans have always campaigned on, John McCain campaigned on this in 2008, Mitt Romney campaigned on this in 2012, Paul Ryan, Tom Coburn, all the leading lights in terms of health care reform on the right have talked about, let's give people the money, tax credits, vouchers, premium support, whatever buzzword you want to use, and let them shop for the plan they want. And if you just take the Obamacare tax credits and get rid of all the mandates and the regulations, you can get to a similar place. So that's step one. Step two is you gradually raise the eligibility age for Medicare. So today, you turn 65, you're on Medicare. But if you gradually raise the retirement age for Medicare over time, what happens? If you're low income, you're still protected because the exchange subsidies are means tested. So if you're under 400% or 300% of the federal poverty level, you're making $40,000 or less, you're still protected. You're still getting subsidized health care. But if you're wealthy, if you're Mitt Romney or George Soros, you're not going to get the same level of government subsidy over time. And so by gradually raising the retirement age of Medicare, people who are on Medicare today, they're protected. They're still in the Medicare program. But people my age, maybe I don't get onto Medicare until I'm 71 or 72. And that's fine by me because it's that or the country's broke. So, I'll take that trade. The next thing you do is offer the same type of private health insurance to people on Medicaid. Give them the opportunity to shop for the health care that's best for them, or put it in a health savings account so they can save for their health. What we don't have in this country is a pathway for the poor to save for their own health care, for a better future for themselves and their kids. Imagine somebody who's in poverty today, who has a system like this, who stays healthy, stays out of jail, eats right, works out, and is healthy enough over the course of his life that he can take his nest egg from his health savings account and give it to his kids. Think about how transformative that is for somebody who's mired in poverty today, compared to the system we give them today, where you're on Medicaid, and if you actually take a job, you're kicked off the system because you're no longer eligible for it, right? That discourages people from seeking work. It discourages people from lifting themselves out from poverty. So we can completely change that, and not only do that, but offer them a better quality of health care and health coverage than they have today. The other thing you can do is all the grab bag of stuff we always talk about. Fix malpractice litigation. Let veterans have access to the private health care system. Do something about all the hospital mergers in this country that are actually doing a lot to drive up health care prices. So we run the numbers on this. We worked with an economist at the University of Minnesota who does a lot of congressional budget office style fiscal modeling. And what we found is that over a 30-year period, we can reduce federal spending by $10.5 trillion and the deficit by $8 trillion, because we also reduce taxes by a considerable amount using this approach. You make the Medicare Trust Fund permanently solvent, not solvent for another 5 years, another 8 years, but permanently solvent. And you also do a lot to stabilize state budgets, because as many of you know, state budgets all over the country are facing the situation where the cost of Medicaid keeps going up and up and up, and that's crowding out funding for education, for highways, for police, and all the other things that states traditionally spend their money on. That's not all it does, right? So that's the part that conservatives will like. But there's some things in here for Democrats too. You're actually improving the quality of health care for the lowest income people in America. You're actually expanding the number of people who can get health insurance. Why? It turns out that if you actually deregulate the insurance market and make health insurance less expensive, magically, more people will be able to afford it. More people will buy it. So you don't need to mandate and regulate everything in order to give people more health insurance. We don't mandate and regulate everything to give everyone, iPhones or smartphones, right? Smartphones have been adopted because they've gotten less and less expensive. And the same thing can be true with health insurance if it's designed the right way. So you can actually have more people have health insurance with less government intervention than we have today. But that's the kind of thing that a moderate Democrat will say, okay, I'm listening. He's not going to dismiss it out of hand. So with that, I'm going to yield to questions, Roger, if I haven't used up all my time. Thanks for listening.
Well, I'll take the moderator's prerogative here and ask you one question. This is a very compelling idea, Avik, and I've heard it several times, and I think it's terrific. Do you think that the American public would accept that? Do you think the American public will want to make their own health care decisions and spend their own health care dollars?
Yeah, it's a great question. I mean, certainly there's going to be some people who believe that that's not true, who are going to try to make political hay out of saying, oh no, you know, if you have your control of your own health dollars, you're going to make terrible decisions and you're going to be exploited by greedy profiteers in the healthcare industry. There are going to be people who say that, but the average American wants control of their own health care dollars. If we have a campaign in 2016 where Hillary Clinton is saying, trust me, the government should control your health care dollars, and the Republican candidate is saying, no, I'm going to give those health care dollars back to you to control, I think that's going to be a hard argument for Hillary to win on. And she has a long track record of advocating control by government experts. I don't think that's going to be a winning argument.
Yeah, great. Let's open it up for questions. Yes, sir, right here.
The law was written to incentivize states to adopt exchanges. Now, the federal government is subsidizing what the law says only the states could do. What happens if the Supreme Court knocks that down?
Yeah, great question. It's a question that's obviously that's a hot topic right now with this. So many of you may know this. There's a Supreme Court case called King v. Burwell that's going to be decided this year by the Supreme Court. And the question is a fairly technical question. There are state-based exchanges, and there's this federal exchange for the states that didn't set up their own exchange. And so the way the law is actually written, the letter of the law says the subsidies in Obamacare can only flow through state exchanges, not the federally run exchange. But the Obama administration just basically decided to interpret the law as saying, well, we really meant to have those federal subsidies flow through federal exchange. So a lot of states, like Texas, a lot of Republican states that didn't implement their own exchange, they're getting all those subsidies through the federal exchange. If the Supreme Court sides with the challengers and says that federal exchange is, well, it's legal, but the subsidies can't flow through it, there's going to be a lot of disruption in those states. I think what you're going to see, frankly, is a lot of people are saying, well, this is going to blow up Obamacare. I don't actually agree with that. I think what you're going to see is you're going to see the Texases of the world set up their own exchanges. Why? Because that's $500 million of federal money that wouldn't be going to Texas if they didn't set up their own exchange. So I think there's going to be actually enormous pressure on Republican states to set up their own exchanges in order to take that money. Now, I think there are some things Republicans can do in Congress to achieve a better outcome than that. But they're going to have to be pretty smart about what they design as legislation. And I've been doing some writing on this. There are ways, and I just say follow my work on Forbes to follow this debate about what we can do differently. There are some things that maybe give Republicans more bargaining power to open up the law and reform it if the Supreme Court sides with the challengers. But I think this is actually not necessarily some big win for the Republicans, because a lot of Republican states are going to decide to set up exchanges, and they're going to have to embrace and implement Obamacare if those federal subsidies don't flow through the federal exchange.
Yes, sir, in the back.
I have a question specific to the individual market, and I suspect that people that get their health insurance through the individual market are very disproportionately overrepresented in this room, since it's full of entrepreneurs and business owners. And this is the class of people who I think have been the most damaged by Obamacare. That's certainly true in my case. Now, you put up a chart, and the charts are kind of hard to read from the back because they're pretty busy. But there was a map of the United States, and there were different colors on the chart, and there were a handful of states where the individual market premiums had actually fallen.
Yeah.
That's it. Now, in New York, are you in New York or D.C.?
I live in New York City, yeah.
Good. In your state, it's down 40%, the most in the entire country.
Yeah.
And right next door in Connecticut, it's up 42%.
Why is that, is your question?
Indeed.
Yeah. So there's a reason. So Mario Cuomo, who died this week, or this weekend, when he was governor of New York 20 years ago, or 30, yeah, 20 plus, yeah, he lost in 94. So this is like around the early 90s. Remember when Hillary Care was coming out in like the early 90s, right? 92, 93, 94. So when Hillary Care failed, a number of states decided, like Washington State actually, to set up their own Hillary Care-like legislation. And New York was one of the most aggressive states in this regard. So New York passed a law that said that you couldn't charge people different rates of for their health insurance based on their health status. You couldn't charge them different rates based on their age. You had to issue insurance to everyone regardless of whether they had pre-existing conditions. So everyone basically had to be charged the same insurance rate regardless of whether you were healthy or sick, old or young, whatever. So that was obviously a great deal for the sick people. It was a terrible deal for the healthy people. So the healthy people all dropped out of the market. So basically, I'm 42 years old. If I want to buy health insurance on the individual market in New York City, pre-Obamacare, it would cost me $1,200 a month. Right? So basically, no one's going to buy that because if you're generally healthy, you're not going to buy that. So why are prices going down so much in New York because of Obamacare? Because now there's an individual mandate that forces everybody to buy insurance whether they want to or not. Now there are subsidies that subsidize health insurance for maybe the healthy people who are otherwise priced out of the market if you were low income enough. So you put those two populations into the pool, you all of a sudden have a more functional market from the standpoint of the average price of the insurance plan. So basically, Obamacare can be thought of as a gigantic bailout for New York. I guess we got time for one more question.
Yeah, one more question. Do we have one more? Yes, sir.
Could you explain the fundamental difference between Romney Care in Massachusetts and Obamacare?
So I once wrote a long article about this for Forbes called How Deval Patrick Gutted Romney Care, because Deval Patrick was the governor who succeeded, Democratic governor who succeeded Mitt Romney as governor of Massachusetts. Now I should mention, I helped advise Romney in 2012. I was a huge critic of Romney Care in Massachusetts because I think the individual mandate and that approach to health reform is a bad idea. But what is the biggest difference between Massachusetts, the Romney Care Massachusetts and the national? It goes to a lot of what we were just talking about. So Massachusetts, like New York, had this system where everyone had to be issued insurance of similar prices. It wasn't as bad as New York, but it was pretty aggressive. So that meant that the insurance market in Massachusetts, like it had in New York, collapsed. And so Romney Care came and said, okay, now you have to buy insurance, and that brought prices down somewhat. So think about it this way. For every state like Massachusetts or New York, which had a heavily regulated insurance market already, Obamacare didn't really change much except it brought more people into the pool through its mandates and its subsidies. But if you were in a more free market-oriented state, and frankly California, for all of its reputation as a blue state, has had a pretty free market-oriented health insurance market for people who shop for coverage on their own, in California, costs have gone up. In Texas, costs have gone up. Even in Washington, where actually there was a fairly heavily regulated market, prices have gone up. So in most of the country, where you did have a lot of choices to buy health insurance, where the insurance company could charge a younger person less or a healthier person less in line with their actual health insurance needs and risks, those people said, okay, health insurance is a fair deal for me, I'm going to buy insurance. And so they had a more functional market. But in those states where that wasn't true, Obamacare is either is a huge help or it's not having much of an effect one way or the other. So the way to think about Obamacare is it introduces the federal regulation of the health insurance market in a way that didn't exist before. So if your regulations are already aligned with that because they were already really aggressive, you weren't really affected by Obamacare. But if you were in the majority of states that didn't have that regulatory architecture, who now face a much more heavily regulated insurance market, you're paying a lot more. So Romney Care was fine for Massachusetts because Massachusetts already had a very regulated market. And so actually Romney Care made Massachusetts more market-oriented than it was before, but that's because Massachusetts was kind of a socialist utopia to begin with, or dystopia to begin with, right? So for the states that are more market-oriented, if you apply Romney Care to those states, that would be a move in the wrong direction. It's all about the directionality, right? So Massachusetts over here, Texas or California is over here, Romney Care is like here, right? So Romney Care moved Massachusetts to the right, but Romney Care would have moved Texas way to the left.
Great. Well, thanks very much. We're running out of time. We're out of time. Please join me in thanking Avik.
Thank you, everybody.